Hello, in this video today I would love to share with you a few things, a few insights that I have had as being a physician. There is beautiful Phoenix, Arizona, Dreamy draw. What we are taught as doctors is a fact. We are being taught facts coming from science, coming from research, coming from the doctors before us and the before us and the before us. And when I go back and see where does the information come from, that is a really good question, because I remember through the whole naturopathic school and many years after, we were taught that glutathione in a reduced form doesn't absorb in the stomach, that it gets destroyed in the stomach, thus it has to be used intravenously. So the best form of glutathione, which is a powerful antioxidant and a number one detoxifier, needs to be done parenterally, or then later on they came up with a specific form of liposomal glutathione that dissolves in the mouth and absorbs through the buccal mucosa, and or is being bound to acetyl group, so S-acetylglutathione. Those are to be better absorbable. And it wasn't until one seminar I went to where a doctor shared the study that this notion came from, that this knowledge came from about glutathione being non-absorbable. And that study, the way she broke it down, didn't actually hold any bearing. Like it did not stand as far as for that to be the outcome. And I remember that day I just paused and I thought, where is all of our information coming from? I was watching Facebook, and there was a Facebook Live, and a doctor that I respect said, take your vitamin D at night. And I thought, okay, that makes sense. She didn't really say why. She didn't elaborate on any research. I have not heard that before. Everything I have studied is the most important thing is to take it with food, and to make sure it gets absorbed and make sure we don't exceed certain dose, and to test it, because otherwise it could actually be toxic if it's not too high of a dose. And I thought, okay, that makes sense. And then I caught myself doing a video or speaking to a patient and saying, take the vitamin D at night, a few days later. And I thought, why did I say that? I have not said it before. And I just took it from her, and because I trust her and trust her as a doctor, I just took it and transferred it on. And so I passed it on, I believe I was making a video, so I might have passed it on many other people, not even knowing where it came from. And I thought, okay, that is so many times how we have actually done things. It's just I have been to conferences, one conference after another, one textbook after another, one seminar or one lecture after another. And I thought, where do we get our information? Where is the research coming from? So most of it is based on research, and some of it is based on somebody else teaching us something that I have trusted. So many times during lectures, there are messages being put out there that are not always, not every PowerPoint that I am witness to at a seminar or lecture has the research studies attached to it. So what that means is I'm taking the word for the doctors that is teaching it. And I don't ask where the doctor is taking it from. The doctor takes it from, possibly another doctor, and that one from another doctor. And when does the doctor take it from? Possibly from a study that may not even have justification, like the one we were studying about glutathione. And then to take it to a completely next level, when we base everything on research and trials and double-blind placebo studies and everything. You remember that study where electrons and protons are being visualized on where they fall in the back of the screen, where they fall on the screen. And when nobody is in the room, there's a very much a significant pattern of every little place is taken and the electrons and protons fall everywhere. There's a nice distribution. There's no rhyme or reason to where they fall. And when there are people in the room, when there are scientists observing, they actually fall in a different pattern. And they fall in the pattern of expectation of where the scientists believe that they would go. So they follow the thread of consciousness of the person in the room. When we really step back and think about every single study is being collected that way, every single study is being prepared to begin with for a certain outcome. There's a certain expectation of the study, hence the study is written in a way that, out of 100 different things I wanted to happen, I'm gonna make sure the 3 I really want to happen, I'm gonna ask the right questions and I'm gonna do the right things for them to happen. So the study is already set up for a certain outcome to happen. And then from that powerful experiment that I just described to you, it's very highly likely that the study is affected by the consciousness of the person putting it together and by all the consciousnesses of the people being part of the study, whether those that are putting it out there or distributing the medicine and or collecting the data and or the people receiving the medicine or anything that we are studying. So if we look at all of this and really, really pause and look at the truth in medicine and science, we are going to realize that we don't really know what the truth is. Are we learning the truth? Are we putting out there the truth? And then being so many minds involved, there are probably multiple truths. So if we take the whole medicine, we may really realize that we don't know what we think we know. And I think that's the biggest truth in medicine is we do not know. We do not know. We do not know. I think if we could own this as being part of the medical establishment, as being doctors, as the patient coming to us, owning that, and then we're all doing the best to create an overall state of well-being in the person, of course in my own life and in the person coming to me. I do the absolute best that I know. And if I could come from that place that nothing is a constant and that everything can change, and that where the truth is coming from and where I have learned about medicine many years ago, that could be completely different. I think if we could own this, our medicine would absolutely take off as far as health, as far as well-being, as far as just people owning the power in their health and understanding that they are in the driver's seat when it comes to health and well-being.